This is a research institute, so I wanted to ask you, how far have we got with research into this disease? Are there drug trials in progress at the moment? Are breakthroughs being made?
Well, research into Alzheimer's disease has made enormous progress in the last 20 years. Now, you probably know that the disease was first described in the early 20th century by Alois Alzheimer. And of the 110 years since then, the last 20 have seen a phenomenal acceleration in knowledge and understanding of this disease. Now, this knowledge has enabled us to identify target molecules for new drugs. What do I mean by this? Well, that we've discovered and we've understood which molecules, which toxic proteins in some way trigger the cascade mechanism that leads to neurodegeneration and also cell death, the loss of synapses and thus to cognitive and behavioral disorders, and so on and so forth. These target molecules are basically two proteins called beta amyloid and tau, and this has enabled us to develop amyloid and tau blocker drugs. Now, these drugs are now being developed. They're undergoing clinical trials in Italy, in Europe, and worldwide. And in fact, during the next few years, we'll find out whether these clinical trials prove that they're effective in slowing down or even stopping the progression of the disease.
What can I do to get my father enrolled in these clinical trials? Is it possible?
Well, yeah, it's certainly possible. You need to find out which centres are trialling the drugs. This information is usually available on the internet, but of course you must be aware that the rules that govern recruitment for these clinical trials are very strict. Now, your father has to comply with specific medical and demographic criteria to get onto one of these trials. And I'm afraid that nobody can stretch or bend these rules because they're trials that use a drug, a substance whose effects on the body are not really completely known. And so the criteria for choosing the people who are going to be exposed to these substances, well, they have to be very strict, I'm sure you can understand. This is one factor. The second factor that you have to remember is that if your father is enrolled in one of these clinical trials, there's no guarantee that he'll necessarily be given the drug. All these trials work on the double-blind principle, using a placebo. In other words, some of the patients take the trial drug and some take the placebo, meaning tablets just like those containing the drug, but without the active substance. And nobody, neither the doctor nor the patient, and not even the company that produces the drug, knows which patients are taking the drug and which are taking the placebo, unless unexpected reactions or serious adverse events occur, in which case the blind is removed, but otherwise the blind is maintained until the end of the trial. So if your father is enrolled in one of these trials, he has a 50, 60 or maybe 65% probability, depending on how the trial's designed, of taking the drug, and a 50, 30 or 33% probability that he won't actually get it. So it's a little bit like buying a lottery ticket. If I don't buy a ticket, then I'm certain that I won't win. If I do buy one, I might win, but then again I might not.